Hello, I'm Dennis Pullin. One of my favorite parts about being president and CEO of Virtua Health is getting to know our colleagues and the many ways they are here for good. Each person contributes to healthy communities, and each person has a story to tell. Let's meet one. So, Aimee, welcome to Here for Good.
Thank you. Thanks for having me.
So, this is not the first time you and I have met. Were you surprised when I showed up as a patient?
Absolutely. Absolutely. I won't lie, I was a little nervous seeing your name pop up on our schedule. As it turns out, I really had no reason to be.
Here's a little secret. I was more nervous than you. And the reason you are here today is because the thing that you did for me was to create a sense of ease and comfort. And I felt like I had the best possible professional that I could have had that day to look after me. And with that, you left such a tremendous impression upon me. So thank you for being here for good for me. And as you and I had a chance to talk, I found your story to be quite inspiring. I know you too at one time was a patient.
Right.
Can you share that with me?
My story kind of begins with being laid off from a previous job. And I took that opportunity to stay at home with my kids for a few years. And when it was time to go back into the workforce, I wasn't really inspired at my prospects. As it turns out, I didn't have a whole lot of time to think about it. And I got this unexpected cancer diagnosis. There's definitely no good time to get news like that. But for me, the timing was kind of paramount. And the experience that I had as a patient was just phenomenal.
Really?
Yes, so that inspired me to pursue a new career path in radiology.
What stuck out with you as a patient to where you said your experience was a phenomenal experience? Was there anything that you could sort of point at?
People that cared for me made me feel safe, made me feel like I didn't need to be scared about what was in store for me. And that made all the difference for me. I always felt like I was in good hands.
So someone did for you what you did for me.
In working in healthcare, that's always been my goal.
It's about being here for good. So continue on with your journey.
I really just kind of became fascinated by what I was seeing. So healthcare was never on the radar for me. Never had an interest in working in healthcare. Never really even thought about it. And suddenly I was kind of thrust into this world where I was getting all this diagnostic imaging. So x-rays and CAT scans, MRIs, things that I had no reason to have experienced before. We live in our bodies our whole lives, but how often do we get to see a snapshot of what's going on the inside? So it's kind of cool. I get to do that every day.
So you started out not in imaging. Walk me through your journey now that you're here at Virtua.
So I applied to X-ray school and I got accepted, and they only took 12 students a year. Unfortunately, there was a 2-year wait list. So that was kind of deflating at that time because I had decided this was what I wanted to do. I was going to go for it. And then suddenly there was this big wait. I got some good advice at that time, and someone had said, well, time is going to pass either way. The best way for me to pass the time was to get a job at the hospital. And for me, that job was in environmental services. So I worked in EVS for 4 years while I waited out the wait list, and then the 2 years while I was in school. And the funny thing is, in the beginning, there were a handful of people that would approach me and say, you look just like this girl that works in housekeeping. And I'd say, oh, funny, that's me.
That is you. So that clearly is a part of a journey that not many people would sort of make that sacrifice to do. Tell me about the people you work with and the people you worked with in environmental services and your current role in imaging.
Everyone I work with is fantastic. All of my coworkers were very supportive of my goals. My managers really did what they could do for me to accommodate with my schedule.
Did you get to experience or see the hospital through a different lens, being an EVS worker as opposed to the imaging?
Absolutely. It was definitely a unique perspective to experience a healthcare environment. I knew the building inside and out, top to bottom, and could see all different facets of different departments, different modalities, how each person kind of factored in to how a patient enters and exits the building. I learned a lot about infection control and patient safety, things that I was able to take with me into my new job in radiology.
The commitment in order to do what you did in terms of working while being in school. And I'm sure you also have other outside interests. So when you're not taking care of patients, what is it that captures your attention?
My passion is kind of right now renovating an old house. So,
Renovating? You just could not sit still. So renovating an old house, huh?
yeah. So I bought a house a few years ago. Has lots of projects, and that's kind of what I spend my free time doing.
So clearly you're not afraid of hard work.
No, absolutely not.
Some of your fellow colleagues were very supportive of you when you were in school trying to progress. What advice would you give someone that may be in a similar situation, or someone that is thinking about going back to school at later on in life, or a second career, or making, what advice would you give someone?
I would say that if you want something badly enough, it's worth putting in the time and the effort. Nothing worthwhile is easy. And like I said earlier, time is going to pass either way. So if you have a goal, either you're going to work towards it and achieve it, or in that same amount of time, you're going to just be thinking about what you could have done.
You hear people all the time talk about work-life balance, and I'm one of these individuals that I don't think it's ever balanced. Sometimes it, one's up and one's down. You just sort of figure out how to navigate. Was that perhaps your biggest challenge?
Absolutely. It definitely was a challenge. And my goal was always for my kids to not feel like anything was missing for them. I didn't want them to feel that I was too busy with school or too busy with work to parent them the way that they were used to.
And I would imagine that they're pretty proud of their mother.
I think so.
You think so?
I hope so.
And you really sort of provided a great example for them to follow. I guess my last question, what does being here for good mean to you?
For me, it's kind of a twofold concept. So when I think of here for good, I think about it in the sense of security and stability, that, Virtua has a very prominent presence in South Jersey. And I knew getting to this field that I wanted to work for Virtua. And having been through a layoff at some point in the past, that job security means a lot to me. And then, of course, the more literal sense, here for good, that's what we're here for, to take care of our patients and each other. And I'm glad to be a part of that.
And I would echo that. You were here for good for me, which made a big difference for me as I went through my imaging studies. And so thank you for joining me today. Thank you for sharing your story. And thank you for being here for good.
Thank you.
What an inspiring and exciting journey that she has gone through. Her commitment to our colleagues, to our patients, and to our community. Again, join us in the future for another exciting episode of Here for Good, the Inside Edition.